Good day everyone, my name is Maria Evanel Noveno from BSN 21 PLM College of Nursing, and today I will be showing you how to assess the Apgar score and anthropometric measurements of a newborn. But first of all, what are the Apgar score and anthropometric measurements and why do we need to take them? So the Apgar score is a simple and convenient method of assessing the health, vital signs, and need for resuscitation of a newborn. It is invented by Dr. Virginia Apgar in 1952. Meanwhile, the anthropometric measurements are quantitative measurements of the newborn's body weight, head, chest, and abdominal circumference and length of the newborn that helps us determine the maturity and physical abnormalities of the newborn. So now that we know what are the Apgar score and anthropometric measurements and their purpose, let's move on to the assessment. For the assessment, we need to take the Apgar score of the newborn. So the score ranges from 0 to 2 and it is taken twice immediately after birth. The first one is taken 1 minute after birth and the second one is taken 5 minutes after birth. And there are 5 areas to assess. The first one is the appearance or skin tone of the newborn. So if the baby is pink all over, the score is 2. But if the baby has a pink body but blue extremities, also known as acrocyanosis, then the score is 1. But if the baby is pale all over, the score is 0. Next is the pulse or heart rate. So if the baby has more than 100 beats per minute, the score is 2. But if the baby has less than 100 beats per minute, the score is 1. And if the baby has no pulse, then the score is 0. Next is the grimace or response. So if the baby cries at birth, then the score is 2. But if the baby only grimaces, then the score is 1. And if the baby has no response to any stimulus, the score is 0. Next is the activity or muscle tone. So if the baby has active and spontaneous movements, then the score is 2. But if the baby is only flexed at the joint, then the score is 1. And if the baby is limp, then the score is 0. Next is the respiration. So if the baby has a strong cry and is breathing well, then the score is 2. But if the baby has a weak cry and slow breathing, then the score is 1. And if the baby is failing to breathe, then the score is 0. So this baby was assessed for the Apgar score 1 minute after birth. And she had a pink body but blue extremities, so the score is 1. Then her pulse or heart rate was 160 beats per minute, so that is also 2. Then for her grimace or response, she immediately cried at birth and that is also 2. Then she had active and spontaneous movement, so that is also 2. Then for her respiratory rate, she had 50 breaths per minute and that is also 2. Okay, and that is a total score of 9. Then it was retaken after 5 minutes after birth and she scored 10. And both scores indicate that she is in the best health possible. Okay, so after the assessment of the Apgar score, we can now proceed to planning, and that includes gathering and preparing the needed equipment or materials for the anthropometric measurements of a newborn. And that includes the tape measure for the length and circumference measurements, the infant weighing scale, it could be digital or analog for the weight of the baby, the paper or drape to cover the scale tray, the pen, and the gloves, and the 70% isopropyl alcohol solution. So this is done to save time and effort and to ensure that the procedure will be organized and efficient. Okay, and prior to this procedure, I already cleaned the materials and equipment that we are using for the anthropometric measurements to prevent the spread of microorganisms and cross-contamination. Okay, so after the planning, we can now proceed to implementation, and the first thing we need to do is to perform proper hand hygiene, wear PPE or gloves if indicated. So performing proper hand hygiene is the most effective way to prevent the spread of microorganisms and cross-contamination. We can do this by using antiseptic hand rubs, alcohol-based products, hand washing with soap and water, and surgical hand antisepsis. And for this assessment, I will be using the alcohol. Then we can also wear gloves to prevent contact with body fluids such as blood. But for this assessment, let's just assume that I'm wearing gloves. Then we should wear PPE if indicated for transmission precautions, especially now during the pandemic. After that, we can now introduce ourselves to the client and their parents. And this is essential to foster therapeutic nurse-patient relationship that is based on mutual trust and respect. So for example, I will be introducing myself to the client and her parents. Okay, so good morning, ma'am, sir. My name is Maria Evanel Noveno from PLM College of Nursing, and I will be your student nurse for today. I will be assessing your newborn for the anthropometric measurements. Okay, so after introducing yourself to the client and her parents, we should now verify the identity of the client using two identifiers, the name and date of birth or the name and identification number. So this is essential to ensure that the right person or patient receives the right intervention and procedures, and this also helps prevent errors. Okay, so for example, this newborn has an IV band on her ankle. So it is placed on her ankle so that it would not be removed easily. Okay, and it says here that the newborn is a female. Her name is Ana Diaz and she was born on December 20, 2021. And her mother's name is Gina Diaz. Okay, so after verifying the identity of the client, we can now explain the procedure to the client and her significant others and encourage them to participate as appropriate. So this reduces their anxiety and increases their cooperation during the procedure. So for example, I will be explaining the procedure to the client and her guardians or parents. So, hello ma'am, sir, I will be taking the anthropometric measurements of your baby. So first, I will be taking her weight, then her head, chest, and abdominal circumference, and lastly, her length. So I will be using a tape measure and an infant weighing scale. Okay? After explaining the procedure to the client and her significant others, we can now close the curtains and doors around the bed if possible. So this gives the client privacy, keeps their dignity intact, and increases their comfort. So as we can see, the curtains and doors around the bed are closed. Okay, so after ensuring the privacy, identity, and cleanliness, we can now measure the weight of the newborn. So this is essential to establish baseline data and to determine the maturity of the newborn. This is also the most important determinant for the nutritional status and health of a newborn. Okay, so assuming this is an infant weighing scale, the first thing we need to do is to place a paper or light drape on the weighing scale because newborns are highly susceptible to infection. So the scale tray should be covered with a protective clothing or a paper to ensure that the surface is clean and free from microorganisms. So for this assessment, I used a paper to cover the scale tray. Next, we need to calibrate the scale tray or the infant weighing scale to 0 to establish the accurate weight of the newborn. Okay, so let's calibrate to 0 the infant weighing scale. Okay, after that, we need to completely undress the newborn by removing their clothing to get the accurate weight measurement of the newborn, because if we measure the newborn with their clothes on, then that could add to their weight measurement. Okay, so let's remove the blanket of the newborn. Then after that, we need to place the newborn gently on the center of the weighing scale. So gentle handling of the newborn is essential because they are very sensitive, and we need to place them on the center of the weighing scale so that their weight is evenly distributed on the scale tray, and that helps us get an accurate measurement. Okay? After that, we should keep a hand near or over the newborn at all times while they are on the weighing scale. So this ensures their safety so that we can catch them if they fall or slip from the weighing scale. Okay, after that, we should now read the weight of the newborn. So we need to take note of the actual weight of the newborn for documentation purposes. So the average weight of a newborn is 3,400 grams or 7.5 pounds for females. And for males, it is 3,500 grams or 7.7 pounds. Okay, so a few factors can affect or influence the weight of a newborn, and that includes the nutritional intake, the alcohol and smoking habits, and diseases such as diabetes mellitus of the mother during pregnancy. Okay, after that, we can now carefully remove the newborn from the weighing scale. So gentle handling of the newborn is essential to ensure their safety while they are being transferred from the weighing scale. Okay. Then let's cover her again with a blanket to prevent hypothermia. After that, we can now note and record the weight of the newborn for accurate documentation, continuous communication, and interpretation of findings. So the weight of the newborn is 3,400 grams. After that, we can now measure the head circumference of the newborn, and that is essential to detect abnormalities in the growth of the head, skull, and brain of the newborn. Okay? So usually, head circumferences are assessed until the newborn reaches 5 years old. Okay, so first, we need to get the tape measure. Then we need to place the tape measure across the fullest portion of the newborn's brow and around the occipital prominence. Okay, so to get the accurate head circumference of a newborn, we need to measure from the or across the center of the newborn's forehead, then around the most prominent portion of the posterior head, which is the occiput. Okay? Okay, so after making sure that it is across the center of the newborn's forehead, then around the occiput, we can now read the head circumference of the newborn. So the average head circumference of a newborn is 34 to 35 centimeters or 13.5 to 14 inches. And we need to remember that if the newborn has scalp edema or molding due to the birthing process, then the head circumference could be inaccurate until the 4th or 5th day of life. And we also need to remember that a newborn's head is usually large because it is 1/4 of their entire length. Okay? Now we need to note and record the head circumference of the newborn in centimeters for accurate documentation, continuous communication, and interpretation of findings. Okay, so the head circumference of the newborn is 34 centimeters. After that, we can now measure the chest circumference of the newborn, and that is essential to detect the proper development of the chest organs and calcification of the rib cartilages. So measuring the weight of the chest circumference of the newborn is ideally done at mid-inspiration. Okay, so let's move the tape measure. Then we need to remove the clothing on the newborn's chest and make sure that they are completely undressed to get the accurate chest circumference of the newborn. Okay, then we need to measure around the chest of the newborn at the level of the nipple line and keep the tape measure at the same level anteriorly and posteriorly. Okay. So to get the accurate chest circumference of the newborn, we need to measure around the chest at the level of the nipple. Okay, so this is the nipple of the newborn and we need to place the tape measure over it. And we need to make sure that the tape measure is at the same level anteriorly and posteriorly. Okay, so the average circumference of a newborn's chest is 30 to 33 centimeters or 11.8 to 13 inches. But we need to remember that if a newborn has an enlarged heart, then that could make the left side of their chest larger. Okay, so after reading the chest circumference of the newborn, we can now note and record the chest circumference of the newborn for accurate documentation, continuous communication, and interpretation of findings. Okay, so the newborn's chest circumference is 32 centimeters. Okay, after that, we can now measure the abdominal circumference of the newborn. So this is essential to ascertain the size of the abdominal viscera and to detect problems such as necrotizing enterocolitis. Okay, so first we need to remove the clothing of the newborn on their abdomen and make sure that they are completely undressed to get the accurate abdominal circumference of the newborn. Okay, so as we can see, the newborn is completely undressed. Then we need to measure around the newborn's abdomen at the level of the umbilicus. Okay, so to get the accurate measurement of the abdominal circumference of a newborn, we need to measure around the abdomen 1 finger breadth above the umbilicus. Okay, so it is measured above the umbilicus because if the bladder of the newborn is full, then the bladder size could interfere with accurate results. Okay, so this is the umbilicus of the newborn. Then we need to measure 1 finger breadth above it. Okay. Then we need to keep the tape measure at the same level anteriorly and posteriorly to get accurate results. Okay. So the average abdominal circumference of a newborn is 31 to 33 centimeters, But if the newborn's abdomen is asymmetric, then we should suspect abdominal mass. Okay, so after reading the abdominal circumference of the newborn, we can now note and record the abdominal circumference of the newborn for accurate documentation, continuous communication, and interpretation of findings. Okay, so the newborn's abdominal circumference is 33 centimeters. After that, we can now measure the length of the newborn. And this is the second most important determinant for determining the health and nutritional status of the newborn. Okay, so for this assessment, we will be removing the blanket of the newborn. Then, we need to hold the infant's head firmly at midpoint line and extend their legs fully. So, holding them firmly ensures their safety during the assessment, and extending their legs fully ensures that we are getting the accurate measurement of their length. Okay? After that, we need to stretch the tape measure from the crown of the newborn's head to the heel of their foot alongside the newborn's body. So, to get the accurate length of the newborn, we need to measure from the top of their head to the heel of their foot. Okay? Okay, so let's make sure that it is at the top of their head, then to the heel of their foot. Okay, so after reading the length of the newborn, we can now note and record the length of the newborn in centimeters for accurate documentation, continuous communication, and interpretation of findings. Okay, so the average centimeters for a newborn's length is 50 centimeters or 19.7 inches, and the newborn's length is 49 centimeters. After that, we need to cover the newborn again to prevent hypothermia. Then, after taking all the anthropometric measurements of the newborn, we can now clean the equipment and materials that we use and store them in their proper receptacles and perform proper hand hygiene to prevent the spread of microorganisms and cross-contamination. And lastly, for evaluation, we should document the procedures done for communication, documentation, interpretation, and legal purposes, because this document serves as proof of all the interventions that we made, because if it is not written, then it is not done. So that is all for the assessment of the Apgar score and anthropometric measurements of a newborn. Again, my name is Maria Evanel R. Noveno. Thank you for watching.